I'd like to highlight the key difference between iris hook placement versus capsular retractor placement. So here we've got two separate eyes. This eye here will have iris hooks. The take-home point is that you want to place the incision parallel to the iris. And so this incision here, which should be as posterior as possible. I like to go right near the limbus when I'm making my incision. You want it parallel to the iris, as seen in this case. And if you do it this way, then the placement of the iris hook will look just like that. If you do it properly, you will tent the iris in this direction here, which is very, very important. If you do it more at an angled approach, it makes it a little bit more difficult for the iris hook to engage the iris. Your iris hook will kind of look like this, so it's an angled approach. The problem with this approach, as I said, is it can make it more difficult, but more importantly, if you do manage to wrap the iris hook around the edge of the iris here, the direction, instead of the iris, once it's pulled back, instead of going this way with the proper placement, it's going to actually go this way. And you actually can make the situation a bit more difficult. You're more likely to potentially get iris prolapse, or it may be hard to pass instruments in this region because the iris is now tented towards an incision. And so that's the key point for iris hooks, is you want to place it parallel to the iris and as posterior as possible. I usually aim right near the limbus. Now look at the iris hook. It has a basically horizontal direction to it. Let's compare it to the capsular retractors on the other side. And what I want to highlight is that in capsular retractors, you want to do the exact opposite. So for capsular retractors, what we do want is we want an angled approach. Why? Because the capsular retractor has to not engage the iris, it's going to engage the edge of the capsule. If you make your incision horizontally, well, the capsular retractor will now head in this kind of direction. There's no way for it to catch the rim of the anterior capsule. So you actually want to engage it in this direction. And that way, the main reason is because the capsular bag is further back. This angled approach will allow you to go and snag the edge of the anterior capsule. And this is reflected with how the retractors are designed as well. You want the retractors to reach the anterior capsule rim, and then with the way they're designed, they're intended to provide equatorial support. So this video, in summary, highlights the key differences between how you make your incisions. You will make your job a lot easier if you make your incisions in the right direction, and the rest of the case should otherwise go uneventfully for you. Hope you found this case to be useful.